In an ideal world, the detected tumors, no, in an ideal world we wouldn't have breast cancer, that would be for sure, but we don't live in that ideal world. The second best scenario is that the average tumor diameter of breast cancer patients should be less than 1 centimeter with uninvolved lymph nodes. And that is the world of screening. So therefore, I'm a very powerful fighter for screening. So that was just one message to know it ahead, what is my opinion. But in the world we live today, still, we have breast cancer patients with advanced disease at primary diagnosis. So this study is a 1,600 breast cancer patient study from Germany, and I'm presenting it on behalf of 2 of the joint groups from Germany, which is AGO, the Gynecologic Oncology Working Group, and GBG, the German Breast Group. Included 1,600 patients with a median tumor diameter of 4 centimeter, and 60% of them had palpable or sonographically suspect lymph nodes in the axilla. 600 of these patients had in their pre-therapeutic biopsies from the tumor an HER2 new overexpression. So that is the molecule which makes about 25% of the breast cancers to grow very aggressive. Now, since about 10 years, the antibody trastuzumab or Herceptin is being used for these patients when they have metastatic disease, or since 2 years in the adjuvant setting, meaning after surgery. So what we did in those patients who had HER2 overexpression, those almost 600 patients, we used not just chemotherapy, but we used the antibody concomitant to the chemotherapy before surgery. So the patient was diagnosed with breast cancer. If she was HER2 positive in the tumor from a small biopsy, then she was put onto chemotherapy plus the antibody. And the patients who did not have the molecule HER2 on their breast cancer cell surface, they were just treated with chemotherapy. So my presentation today is going to focus on the addition of the antibody to the chemotherapy before surgery. Not surprisingly, but very positive for the patients, even in those patients with advanced disease. The pathologic complete response rate, so meaning the disappearance of invasive tumor cells from the breast and from the axilla at time of surgery, was 45%. And that is the largest, worldwide largest neoadjuvant study with the antibody trastuzumab. And the result of 45% pathologic complete response means quite a good message for those patients, because we know that the patients who at the time of surgery after neoadjuvant chemotherapy and antibody have a very good outcome, but still we have to follow up those patients for at least 5 to 10 years. The second message is that the cardiotoxicity in this trial was in existence, so we did not have patients who had heart failures. Now that was, of course, one of the critical points of the study, because from previous study from the metastatic setting, the addition of trastuzumab to a certain kind of chemotherapy, which is anthracyclines, was or could have a potentially cardiotoxic effect. Probably why we did not have in this study cardiotoxic effect was, first, we did not include patients who were frail. So these patients had a good heart function, so the ejection fraction of the heart had to be higher than 55%. That is very important. Second, we didn't use the cardiotoxic anthracycline adriamycin. We used a less cardiotoxic anthracycline, which is epirubicin. And the third message of the study is that at time of surgery, 80% of the patients with this very advanced disease, by treating them with chemotherapy and the antibody, had free axillary lymph nodes. Now, that is a very important message for those patients. Why? It doesn't give just a good prognosis to these patients, but at the same time, we now perform a second study in Germany, which is called Sentina. And that is so important because all these patients have been treated up until now with a complete axillary dissection. Now, if you see the results of 80% free tumors, tumor-free nodes in the axilla, it's obvious that if you do complete surgery in those patients, you overtreat those 80%. So the Sentina study, Sentinel before neoadjuvant and after neoadjuvant therapy, is one of the most important studies, ongoing studies in Germany, and I would like you to support it positively by the media. Thank you.